There are many medical conditions often require immediate attention, prompting individuals to rush to the hospital's emergency department. In this video we will briefly explain 17 medical emergencies. In the following videos we will fully explain these conditions and diseases one by one, including the cause, symptoms, treatments, etc. Please contact emergency services immediately if you suspect the following. 1. Stroke. A stroke, also known as a cerebrovascular accident, CVA, is a medical condition that occurs when there is a disruption of blood supply to the brain. This disruption can occur either due to a blockage in the blood vessels supplying the brain, ischemic stroke, or due to bleeding into the brain tissue, hemorrhagic stroke. Ischemic stroke. This is the more common type of stroke, accounting for about 87% of all strokes. It occurs when a blood clot or plaque blocks a blood vessel supplying the brain, leading to a lack of blood flow and oxygen to a part of the brain. Hemorrhagic stroke. This type of stroke results from bleeding into the brain when a blood vessel ruptures. Hemorrhagic strokes are less common but often more severe and fatal than ischemic strokes. 2. Poisoning. Poisoning refers to the condition that occurs when a person is exposed to a substance, poison, that can cause damage to the body, leading to illness, injury, or death. Poisons can be ingested, inhaled, absorbed through the skin, or injected. Poisoning can result from exposure to various substances, including chemicals, drugs, plants, gases, food and other toxic materials. The severity of poisoning can range from mild and self-limiting to severe and life-threatening. The symptoms of poisoning can vary widely depending on the type of poison and the amount of exposure. Common symptoms of poisoning may include nausea, vomiting, abdominal pain, dizziness, confusion, difficulty breathing, seizures, and unconsciousness. 3. Heart attack. A heart attack, also known as a myocardial infarction, MI, is a medical emergency that occurs when blood flow to a part of the heart muscle is blocked. The blockage is usually caused by a blood clot that forms in a coronary artery, which supplies blood and oxygen to the heart muscle. When the blood flow is blocked, the affected part of the heart muscle can be damaged or destroyed. Here's a breakdown of the key components of a heart attack. A. Coronary artery blockage. Most heart attacks occur when there is a buildup of fatty deposits, plaque, on the walls of coronary arteries, which are responsible for supplying oxygen-rich blood to the heart muscle. If a plaque ruptures, a blood clot may form and block the artery, leading to reduced or complete cessation of blood flow to the heart muscle. B. Ischemia. The lack of blood flow to a part of the heart results in ischemia, which means that the affected muscle tissue is not receiving enough oxygen and nutrients. C. Infarction. If blood flow is not restored quickly, the affected portion of the heart muscle begins to die. The medical term, infarction, refers to tissue death due to a lack of blood supply. 4. Severe bleeding. Severe bleeding, also known as hemorrhage, is a medical emergency that occurs when there is significant blood loss from the circulatory system. It can result from various causes, including trauma, injury, surgical complications, or medical conditions that affect blood vessels. Severe bleeding can be life-threatening if not promptly addressed. Types of severe bleeding. A. External bleeding. This occurs when blood flows out of the body through a break in the skin, such as a wound or injury. B. Internal bleeding. This occurs when blood leaks inside the body, often within organs or body cavities. Internal bleeding may not be visible externally but can lead to serious complications. 5. Anaphylaxis. Anaphylaxis is a severe and potentially life-threatening allergic reaction that can occur rapidly after exposure to an allergen. Allergens are substances that trigger an allergic response in sensitive individuals. Anaphylaxis is a medical emergency that requires immediate intervention. Common triggers include certain foods, such as peanuts, tree nuts, shellfish, insect stings or bites. Medications, especially antibiotics and non-steroidal anti-inflammatory drugs, and latex. In some cases, Anaphylaxis can occur with exposure to allergens through inhalation or skin contact. 6. Respiratory distress and respiratory failure. Respiratory distress and respiratory failure are serious medical conditions that involve the inability to maintain adequate breathing. These conditions can be life-threatening and require immediate medical attention. A. What is respiratory distress? Respiratory distress is a condition where there is difficulty in breathing, and the body is working harder than normal to get enough oxygen. Signs and symptoms include rapid or labored breathing, shortness of breath, use of accessory muscles other than the diaphragm, to breathe, flaring of the nostrils, cyanosis, bluish discoloration of the skin or lips, indicating a lack of oxygen. B. What is respiratory failure? Respiratory failure occurs when the respiratory system is unable to adequately oxygenate the blood or remove carbon dioxide, resulting in a dangerous imbalance in blood gases. 7. Diabetic ketoacidosis, DKA. DKA is a serious and potentially life-threatening complication that can occur in individuals with diabetes, most commonly in those with type 1 diabetes. It arises when there is a severe shortage of insulin in the body, leading to a buildup of ketones in the blood. Here's an overview of key aspects of diabetic ketoacidosis. A. Insulin deficiency. DKA is typically associated with insufficient insulin levels. In type 1 diabetes, this can occur due to the body's inability to produce insulin. In some cases of type 2 diabetes, especially when insulin is not effectively utilized, DKA may also develop. B. Elevated blood sugar levels. The lack of insulin leads to an increase in blood sugar levels, hyperglycemia. The body's cells are unable to use glucose for energy without insulin, and as a result, the body begins to break down fats for energy, leading to the production of ketones. C. Ketone production. Ketones are acidic molecules produced when the body breaks down fats for energy. Accumulation of ketones in the blood can lead to a condition called acidosis, where the blood becomes more acidic. Symptoms of diabetic ketoacidosis include excessive thirst and drinking a lot of fluids, frequent urination, abdominal pain or discomfort, nausea and vomiting, rapid breathing, Kussmaul breathing, to try to compensate for acidosis, fruity scented breath due to the presence of ketones. DKA is a medical emergency that requires immediate attention. In severe cases, untreated DKA can progress to diabetic coma. 8. Severe asthma attack. A severe asthma attack, also known as an asthma exacerbation or asthma episode, is a sudden and intense worsening of asthma symptoms. Asthma is a chronic respiratory condition characterized by inflammation and narrowing of the airways, leading to symptoms such as wheezing, shortness of breath, chest tightness, and coughing. In a severe asthma attack, these symptoms become more pronounced and may not respond well to standard asthma medications. 9. Drug overdose. A drug overdose occurs when an individual takes a quantity of a substance, medication, illicit drug, or even some legal substances that exceeds the body's ability to metabolize or eliminate it, resulting in adverse effects, and potentially leading to serious harm or death. Overdoses can be intentional, suicidal or self-harming behavior, or unintentional, accidental. 10. Severe dehydration. Severe dehydration is a serious and potentially life-threatening condition that occurs when the body loses more fluids than it takes in, leading to an imbalance in electrolytes and a decrease in overall body water content. Dehydration can range from mild to severe, and when it becomes severe, it requires prompt medical attention. Severe dehydration involves a substantial loss of fluids from the body, either due to inadequate fluid intake, excessive fluid loss, e.g., vomiting, diarrhea, or a combination of both. 11. Deep vein thrombosis, DVT. Deep vein thrombosis is a medical condition characterized by the formation of a blood clot, thrombus, in a deep vein, usually in the legs. DVT can be a serious condition because if the clot breaks loose and travels through the bloodstream, it can lodge in the lungs, causing a life-threatening condition known as a pulmonary embolism. DVT typically occurs in the deep veins of the lower legs or thighs, although it can occur in other parts of the body. The blood clot can impede blood flow and cause swelling and pain. 12. Pulmonary embolism, P. A pulmonary embolism, P, is a serious and potentially life-threatening medical condition that occurs when a blood clot, usually from the veins in the legs or pelvis, travels to the lungs and lodges in the pulmonary arteries. This can block blood flow to a portion of the lung, leading to various symptoms and complications. Pulmonary embolisms often arise from deep vein thrombosis, DVT, where a blood clot forms in the deep veins of the legs or pelvis. The clot can break loose and travel through the bloodstream to the lungs. It is a medical emergency and need immediate medical intervention. 13. Sepsis. Sepsis is a potentially life-threatening condition that occurs when the body's response to infection leads to widespread inflammation and organ dysfunction. It is a medical emergency that requires immediate attention and treatment. Sepsis can affect anyone, and it can result from infections ranging from minor, localized ones to severe, systemic infections. 14. Acute mesenteric ischemia. Acute mesenteric ischemia is a sudden and severe decrease in blood flow to the intestines, specifically the mesentery, which is the tissue that attaches the intestines to the abdominal wall. This condition is considered a medical emergency, as it can lead to damage and death of intestinal tissue if not promptly treated. 15. Meningitis. Meningitis is an inflammation of the meninges, which are the protective membranes that cover the brain and spinal cord. The inflammation is usually caused by an infection, and it can be a serious and potentially life-threatening condition. There are several types of meningitis, with bacterial and viral infections being the most common causes. Given the potentially severe consequences of meningitis, it is important to seek medical attention promptly if you or someone else is experiencing symptoms suggestive of this condition. Early diagnosis and appropriate treatment are crucial for a positive outcome. 16. Hyponatremia. Hyponatremia is a condition characterized by a lower than normal concentration of sodium in the blood. It is considered acute when the decrease in sodium levels occurs rapidly, often within a short period. Sodium is an essential electrolyte that plays a crucial role in maintaining the balance of fluids in and around cells. It's important to note that the treatment of hyponatremia should be managed by healthcare professionals, as correction of sodium levels must be done carefully to avoid complications such as osmotic demyelination syndrome. If you suspect symptoms of acute hyponatremia or have concerns about your fluid balance, seek medical attention promptly. Acute hyponatremia is a medical emergency, particularly when it leads to severe symptoms or complications. If someone is suspected of having acute hyponatremia, seeking immediate medical attention is crucial for proper diagnosis and management. The treatment approach will depend on the specific cause and severity of hyponatremia in each individual case. 17. Hyperkalemia. Hyperkalemia refers to elevated levels of potassium in the blood. Potassium is an essential electrolyte that plays a crucial role in various physiological processes, including nerve and muscle function, as well as maintaining heart rhythm. Normal blood potassium levels typically range from 3.6 to 5.2 milliequivalents per liter, (MEq/L). Acute hyperkalemia refers to a rapid and sudden increase in blood potassium levels. This condition can be potentially life-threatening, as it can lead to disturbances in the electrical activity of the heart and result in cardiac arrhythmias, irregular heartbeats.
The information provided here is for educational and informational purposes only. It is not a substitute for professional medical advice, diagnosis, or treatment. Always seek the advice of your physician or other qualified health provider with any questions you may have regarding a medical condition. Never disregard professional medical advice or delay in seeking it because of something you have read or heard in this content. If you think you may have a medical emergency, call your doctor or emergency services immediately.